Now, in between this, if you see the section of a pons, you will see a linear white bundle which is known as trapezoid body. Trapezoid body. Remember the name when we are doing pathway of hearing? This. Now let's see how is the trapezoid body formed. Okay, how is this trapezoid body formed? Where are the cochlear nuclei I told you? On the either side of the inferior cerebellar peduncle. One is a ventral cochlear nucleus and other is a dorsal cochlear nucleus. So what does this do? This dorsal cochlear nucleus, it relays on the lateral lemniscus. Alright? It relays on the lateral lemniscus and then it contributes to the formation of this trapezoid body, and these structures, they come in the pathway of hearing. When you do later on pathway of taste, pathway of visual pathway and hearing, you will read about this. So you see this horizontal white bundle which is lying here on the basilar aspect here between the lemniscal system and these nuclei which are scattered here, that's the trapezoid body. Okay, so this is the structure of the pons at the lower level. So what do you see? What are the important things to see? What are these nuclei? Pontine nuclei. What do you see here?
Facial folliculus.
Which nerve nuclei you see?
Abducens.
Facial and the
Vestibular.
nucleus. You also see the trigeminal nerve nucleus appearing, and then it will give you the formation of the nerve above. Now at this level, what will happen? Sometimes an important injury can occur. Okay, so damage at this level, which includes the damage of the facial nerve nucleus of the pons lower level. So any damage at the lower level of the pons, which involves the damage of the facial nerve nucleus, all right, can lead to the Miller Millard-Gubler syndrome. Millard-Gubler syndrome. What does this syndrome comprise of? In this syndrome, due to the damage of the facial nerve nucleus, the patient has ipsilateral facial nerve paralysis, and contralateral hemiplegia. Contralateral hemiplegia. That's the Millard-Gubler syndrome involving the facial nerve nucleus damage. Right? So there is ipsilateral paralysis of the facial muscles, contralateral hemiplegia, paralysis of the half side of the body. Contralateral hemiplegia. That's the Millard-Gubler syndrome due to damage in the lower part of the pons. Okay. Now let's see a section of the upper level of pons going above this. All right.